ticking time bomb, meaning if we don't do anything now, the healthcare system will collapse. What am I talking about? It's about too little doctors for too many patients. And why is that cost? It's because of administration. 25% of all the manual labor or human effort is wasted on administration, and this is a huge bummer. Like, this time should have been spent on actual patient care and not on tedious paperwork. So let's take an example, for example, a doctor. When you go to a hospital or to a physician's office, you're not all the time talking to the doctor, but 25% is spent on actually writing a summary or ordering the stuff. And the documents that are involved are medical records, insurance claims, or purchase orders. But also other healthcare professionals, like secretaries, when they work in a hospital or in a lab, they are processing documents like a record, when you get a medical prescription for your GP, or an insurance card like Carte Vitale, or your identity documents. Well, what if the time wouldn't be wasted on all this administration task, but if you could spend it or could substitute it with software, then the healthcare system would be more efficient. Also for the patients, there's a better experience when they have less waiting time and more time to have actually talking to the doctors. Computers make less errors in retyping errors or even manual writing. And when systems talk to each other, it's often more secure than physical documents who can get lost or can get stolen. When you can replace this process with computers, it normally leads to happier doctors and happier secretaries who can spend the time on actually doing what they're hired for, meaning giving care. How is this done? It's an industry term called intelligent document processing. It's a simple three-step process where documents are sent in via email or by an upload. Then we apply multiple services like data extraction, anonymizing, converting it into a structured file, and then sending it back to another software system, often an ERP system or a lab information system. An example here is for medical prescriptions, which is a common case that we see, where we extract all the information from the doctor, the patient, the exams, and the codes that belong to those exams. Well, you think I might have heard this pitch before. I mean, when I was born 30 years ago, we already had something called OCR, and that's true, but there's been three huge technological waves of an evolution in our industry. So 30 years ago, you had template-based, where you, for every type of document, you had to draw like a template where you say, oh, in this location, there's this piece of information. But that caused that you could not work with many variety of documents, not a big variety of documents. Then, about 10 years ago, when I graduated, we talked about machine learning, where you can teach an algorithm also to recognize patterns which it hasn't seen before. But today, of course, we all know large language models and generative AI. It can go beyond what's on the document, so it can get more context apart from what's just on the document. And that opens up a whole lot of new opportunities. For example, the case we do at the university hospital in Antwerp, where we completely automated the process of expenses and invoice processing, which frees up the time for the healthcare takers to take focus on their core task, which is caring for the patients. And besides this hospital, we also worked for a couple big international names like Eurofins, where we handle a lot of biolabs, and even a company like SNCF, because even at SNCF they focus on innovation. So yeah, a lot of proven cases for Klippa. And we do this in the healthcare industry just for one reason: it's going from administrative task to actually patient care, and therefore making sure the same amount of doctors and healthcare takers can take care of multiple patients. So we're a company called Klippa. We're about 100 people. We process about 1 million documents every day. We're 9 years in business, and we're being recognized as one of the fastest growing companies in the Netherlands. My name is Robert Jan. I'm one of the founders of Klippa, and I'm here together with my two French colleagues, Victor and Jimmy. We're at booth number 12, and if you have any process in mind that where documents are still manually processed, then please come see us, and I'm happy to meet you. Thank you. Q&A. Oh, we have a lot of time left. I hope for many questions now. Great.
Amazing talk, thank you. How did you process these documents 9 years ago when there was no LLMs so widely available?
How did we do it 9 years ago? Yeah, when we started the company, everything was still, we called it rule-based. So you write a rule that says if a word is here, the result is there. There was no machine learning that actually could work on such large scale. So yeah, we are helped, I guess, by the technological advancement of AI. And yeah, this is how made the company grow, I would say. Yeah. Other questions? Should I just talk other anecdotes about Netherlands, maybe about... no.
Do you also process handwritten documents such as prescriptions?
Yeah, exactly. So prescriptions is a typical document which is often still handwritten, depending on where the doctors are located, especially in rural areas, it's more handwritten. And yes, we also process those handwritten files. I mean, it depends a bit on the quality of the handwriting of the doctor, whether it's readable. But in general, I would say, yeah, we are able to extract the right exam names and then link it to the right exam codes. Yeah. Yeah. Which languages? Okay, so we're active in 33 countries. I would say our main presence is in Netherlands, Germany, France. We cover every language in the Latin alphabet, which is most of the European languages, of course. So anything in that space. So. Cool. Well, I hope to see people come to the booth number 12. We have a Kingdom of the Netherlands booth. We're 4 companies there. And I think the person next to me is also from the Dutch delegation, sitting right there. Oh, not you. There were a group of Dutchies here. So I hope you're excited to hear a lot of talks from Dutch people, because it's going to be a lot of us right after each other. But again, thanks for your attention.